Hello PIA, this is Mike Becker, your Director of Federal Affairs in the PIA National Office with an instant update for you. The Massachusetts election is now over with Republican Scott Brown winning it. He'll fill the seat of the late Senator Ted Kennedy and the current sitting senator who was temporarily appointed to that seat, Democrat Paul Kirk. Now this election was extremely important as it gives the Republican minority in the Senate 41 seats. Now that 41 seat stronghold, that's enough to filibuster a bill and stop final passage of health care reform. Now, with the news of the election coming in, Senator Harry Reid and his colleagues have been determining the possibilities to pass health care reform, one of which is to have lawmakers come in, finish up, and pass the measure within the next 15 days. Now that 15-day window is important because that's the amount of time that the Massachusetts Secretary of State has to certify the election results. Now, the White House has spoken out against that measure. They are not in favor per se of the Senate jamming health care through. They're much more in favor, they say, of a different scenario, a likely scenario, that the House simply pass the Senate version of health care. Now, as you know, last year the House and Senate passed their own unique versions of health care, the House with the public option, the Senate with an exchange system. Now, the Senate simply can't pass the House version because they don't have the votes to do so. This is really going to rely on the House. If the House members can concede, realize it doesn't have the public option, but passing it is better than nothing for them. Now, if that happens, a lot of deal making is going to have to take place between the House and the Senate. For one, the House is demanding currently that the Senate reduce the taxes on their high-cost plans, or the so-called Cadillac plans, and they're also demanding that the subsidies for people subjected to the new federal mandate on coverage be increased. So again, the House is asking for lower taxes on certain plans, but higher subsidies for certain individuals. So as I mentioned in the previous instant update, some of these possibilities would require use of the reconciliation procedure. Again, reconciliation only requires 51 votes as opposed to 60, and it's designed for budget-related bills, making it very difficult and highly restrictive to pass policy-related bills. In fact, if reconciliation is used, some of the policy provisions in the health care reform bill would likely have to be stripped or scaled back. For example, the pre-existing condition coverage would likely have to be taken out of the bill since it has no direct impact on the budget. That doesn't mean that that provision or other similar provisions would go away forever. They simply could be passed in another way. What it means is that the bill would have to be broken up. It would be additional hurdles for leaders in the House and the Senate to jump over to pass some sort of comprehensive reform bill. It's a big unknown. We're still trying to see how the Massachusetts election is going to affect health care reform. We'll certainly keep you updated. In the meantime, please visit our website, www.pianet.com. Thank you.